Everyone. Today, let's dive into an exciting development in the world of healthcare, the Indo-European Digital Alliance in Healthcare. This revolutionary partnership is setting the stage for a transformative shift in how health services are delivered across two continents. So what exactly is this alliance about? Well, it's a collaboration between Europe and India that leverages digital technologies to enhance healthcare services. With Europe's advanced digital infrastructure and India's prowess in software development, this alliance is a powerhouse of potential. Now, why is this important? In today's world, where access to healthcare can be uneven, digital solutions offer a way to bridge these gaps. Telemedicine, AI-driven diagnostics, and electronic health records are just the tip of the iceberg. By combining resources and expertise, this alliance aims to make healthcare more accessible and efficient for millions. Let's talk about some specific projects. There are initiatives to develop apps that can help manage chronic diseases, platforms that allow patients to consult with doctors virtually, and systems that use AI to predict disease outbreaks. These tools don't just improve health outcomes, they make healthcare proactive rather than reactive. But the benefits don't stop there. This collaboration also opens up avenues for data sharing between countries, which can lead to better research and faster innovations in treatment. And with both regions committed to stringent data protection laws, patient privacy remains a top priority. Of course, such a grand vision comes with its challenges. There are technical hurdles, cultural differences, and regulatory frameworks to navigate. But the progress so far has been promising, and the potential benefits for global health are too significant to ignore. In conclusion, the Indo-European Digital Alliance is more than just a partnership. It's a new frontier in healthcare. It's about leveraging technology to not only treat illness, but also to prevent it, ensuring a healthier future for everyone involved. And for us, as healthcare professionals, it's an exciting time to be part of this digital revolution. Thanks for tuning in, and don't forget to like, share, and subscribe for more insights into how technology is reshaping our world. Until next time, stay informed and stay healthy.
Um, Sheena, maybe you would like to take the flip chart closer and wrap up the conclusions from what we have discussed, if that's okay. If you can put the flip chart a little bit closer to the camera. And bring it closer here. A little bit closer still. That's perfect. Where you are. That's better. Yes, much better. Okay, so these are some conclusions that we have extracted from the conversation today. Do you like to present them? Achin is Health Data Forum project manager. So this is what we found about Europe-India dialogue could be providing.
So based on the cafe knowledge cafe session, the conclusion was how we can bridge the gap between different regions in terms of sharing the data, first and AI later topic. Basically, the first outcome from the participants is scaling the entire data space and AI making it more used for the healthcare system for both the region and both the ends. And then the second point was how diversity as a source of learning is to have diversified learnings around the database, what we will share, and the experiences, the outcomes, and in terms of having the best practices used for data enlargement. And then the next one was rural innovation. That is something which is very important based on the participants' viewpoint. Because innovation comes when the knowledge is shared and the data is ethically used to bring out that outcome. So as that leads to the innovation of what we are actually all aiming here and rolling our goals are for today. Next is finding a way to bridge the gap of data. So of course we come from the different region, data cultures are different, and so as the data maybe collection is different. But to bridge the gap between these two regions, it's very important by sharing the data in a streamlined way where ethically we share the data, we respect the data of each other and work towards it. Then we have the last one, the second part is the data culture and accommodation differences. So when we share the data and when we use that for any innovation or any case studies or research or survey, it is very important that what kind of differences we have, like whatever the outcomes and whatever the fallbacks we face, that has to be coming out to be more synchronized. So the data cultures from both the regions are going to be very different, but we have to bring this together and clear the differences, whatever the we find in the in the going forward steps. Then next one is common data set, which is very important. When we share the data, we have to come to a common conclusion and a common base level where we can work globally and define our aim and our goal even better and innovate a better world here. So that's what the overall point we have come with. If anybody from the participants would like to add something, please be the best. Yep. Okay, great.
Great. Thank you so much. A round of applause to China. It's a good, it was put on the spot and she responded brilliantly. Thank you so much. But this was the conclusion of this work group here. Maybe from this, Professor Rajendra Gupta, some additional comments, joining us from India directly.
Thanks, Paul. Firstly, congratulate you for pulling off this one. Not easy, let me tell you, and more so during the World Health Assembly. But I think you put a very impressive gathering of global experts poured around the topic. And thanks for accepting to kind of co-host this campaign, and which has brought right stakeholders. And what you have done, which I think I would credit Steve also and others who joined us, is for the first time, we're putting a spotlight on what will drive healthcare forward rather than getting carried away by the shiny object called AI. And I looked at all your 6 points, though I couldn't get the 6th one right unless it is data sets.
It is data sets, yes.
Yeah, then it's fine. So I look at making data more useful, diversified learnings and outcomes, best practices, frugal innovation, bridge the data gap, data culture, and data set. I think to me, it addresses data as a system, which is excellent. I would prioritize data as a culture, so we should have the culture of data-driven healthcare. I think that's to me looks like an overarching theme that we should practice. And within that, we should look at what kind of data are we talking about. So the quality of data comes in first. Is where we should look at what kind of data are we talking about, because in health data there is certainly personally identifiable information, and we also look at what kind of things we have. I think there's Elisa from primary care. I think this is where we have to see where do we start, where are the starting points for data, the collection of data, who are going to be collecting. So one of the things that we missed in these 6 points is capacity building. I think we should put capacity building for data, because we got to train people for data. If we really want to make data first, AI later as a successful campaign, we need a lot of awareness as a part of the culture. We also need trainings. Unless we do that, because if those of us who work in the field go, most of the people don't even know what we are talking about, how to collect data, where it is stored. So the basic hygiene measures around data is something we got to talk about. See, while we say that, there is an issue of data privacy and data theft, but that inadvertently people do not know the importance of data and they share it. That's also data loss. It keeps moving on. I mean, it amplifies. So there are basics around data that we need to solve. And I think the word data culture to me appears to be a very important word here as a key takeaway. And within that, we could build up more. But overall, I think great work accomplished in a little over half a day. But it sets us to solve at least more than half of the problem if we are able to address the data part of health. So very excited about what will come forth next, but look forward to more discussions as we proceed in this. Thank you.
Fantastic, fantastic. Thank you so much. So, dear participants, anything else you'd like to add on these words as we are moving closer to the end of our session? As acknowledged here by Professor Rajendra Gupta, a very productive session, and obviously thankful for the gaps that were brought by this concept of creating capacity. Right, we missed it altogether. But if I was maybe Sheena, you could write it on the board, the last point.
Yeah.
Building capacity. So that's we're going to create a collective board on.
So Paul, sorry for interrupting, but I think even Dr. Manpreet, once she goes to recording, Health Parliament is going to prepare a paper out of this entire discussions you all had, so that it becomes a very structured two-pager for all of us to refer back to.
Fantastic. This is awesome, and we can collaborate that and that. So I think it's building capacity, right?
Yeah, capacity building, yes, whichever word you put it. Yeah.
Fantastic. Anyone else would like to add something as we wrap up the day today? Want to say anything about the first page? Good idea. Okay, so we also had some comments from the World Cafe discussion. Sheena, would you go?
Yeah, so we define AI as a the definition, what means for us is basically quality, AI, ethics, and data.
So that will mean need of further definitions,
Yes,
right?
further definitions which we define today in the discussion. And then what are the more important things we focused on was return on data, how important it is to get the data correct and in the return to the patients or to the clinicians need to have a right feedback and results for them out there. And also importance of classification is very crucial. Then we have ethical issues, collecting versus using. So basically the data which is being used ethically should be driven and also be not only in collecting, even in using them. So both end to end should be the more ethical way and signified. Involvement of MDs is very important, what we felt. And then we have, multidisciplinary.
Yes, efforts to take all perspectives on board.
Yeah.
That's about it. Thank you so much, Sheena. So any comments from these conversations?
Any question is, how do we proceed? Giving this.
What will be the next step?
Yeah, what will be the actions we can individually take or whatever?
Good point, and that's obviously a question that we are eager to hear from you, Rajendra. Next steps.
Yep.
What will be the immediate next step?
Excellent. I think I like this pointing out to saying this is all great. We are all very good at coining terms, creating campaigns, but what next? I mean, how does it change the situation on ground? I would go back to the fact that there could be waves at the ocean's top, but no grain moves in the bottom of the sea. So how do we move that? So if you go back, Paul, to our discussions very early on when we were on a call with Steve, is that we need to create the culture of data in the healthcare system. And between that, we need to create certain points about collection of data. Like this is one of the biggest challenges. Like what's the source of data? We need to get right out there and give people granular guidance on what data you collect, where to collect, what are the storage practices. Because if you do not address those data journey points, I mean, I'll call it the journey of data, because data will move. I mean, people will not move eventually over a period of time because of digital interventions. So how do we, it's not going to be easy, but I think we would need many more sessions on each touch point of the data. What do we do? What are the rights and what are the obligations also? You cannot have right without obligations. So what happens if I share my data with my physician? Then I have right to ask him for my care. But what kind of data do I share with him or her? So I think I would look at the patient's journey in the system, along with that mapping the data journey. First step would be that, and then we get into decide what kind of data is required for what kind of people. So there are individual level data, there are population level data. People like Steve would need anonymized data for country level to take care of the country level policies at WHO. So the requirement of stakeholders will also change with time. The higher you are, the more anonymized or pseudo-anonymized data would be useful for you. The more individualized it gets, the more granular data I need. And that's where I think the trick lies in terms of working around this issue of data first. So what kind of data we would need? I mean, as when I write policies, I would need country level versus the state level data for state policies. So I think we will have to get to sit to more sessions and come out. My key takeaway from this thing is, let's focus on data first as a campaign. Where this starts, who is responsible for doing that? If we have to create a data first culture, every organization should have the quality. If quality is an issue, what is the quality in data? What do we call quality in data? Today, I mean, trust me, WHO takes data from countries. When I write policies for my country, NCT data is going back to 2019, 2022. How on earth will I decide in 2024 about it? So I think all countries will also have to take obligation and will not. I think one of the reasons there is a data taboo also. Let me tell you, how do we create that out? Most of the governments shy of telling the factual situation for political reasons. But I think unless we accept this fact, how we will act on it? I mean, old data is like old newspaper. You don't read it. So, and I'm telling you the truth. If we really want to correct it, we need to educate our bureaucrats and policymakers in the system that we need to make data correct. We need to do that. So there are multiple levels that we have to operate to get this going, working with industry body, working with government. So what Ricardo runs as Unite Network, probably partner with them because they have parliamentarians in that. That's what Alan also told me last time when I was in Geneva 2 months back. So we will have to create a roadmap and we will have to create an action plan. And then only it will happen. And I think we need Steve's support. Almost every organization that works globally, so that we can ask our members, what are we doing? Is there a 5-point charter that we need to look at? And we got to assure them. I think one of the biggest stumbling blocks I see, which also we should discuss, is data security. No one is going to share it. No one is going to keep it unless we assure them data is secure. How do we do that? So let's also mull on that a little more. Like, how do we assure people of data security? How does data move from countries? I think this is one of the biggest challenges that we are seeing and will continue to face even within countries. Two organizations are not willing to share data in healthcare system. How do we do that? So is health information exchange the answer? Like my country is setting up health information exchange, so the data, and it is federated, so it doesn't rest in central repository. So those kind of decentralized databases are something that we have to look at. So certain principles of data we'll have to put at, like what does decentralized mean, where it is stored, who's responsible, who's data fiduciary. So I think all those answers will have to be given to answer that brilliant question that has been put.
Fantastic.
It's not going to happen in a day. It's not going to happen in a week. It'll take some time.
Absolutely. Great points here. Anything that we could add from this side of the world in the room here in Geneva?
Well, doctors may think data collection will interfere with their daily practice, and that is not the case. We are just collecting the data what is existing. So there should be real explanation on what is the importance of data collection. It's not like interfering with practices, it's just collecting raw data. And that, I think in the field of doctors, they may think, oh, people will interfere with our AI and this. That's not what we are going to do. It's just about the data, the quality of the data, and not the quality of care.
And that's something that I extracted from this final intervention is the data first culture. The data first culture is really, really important. And that's something that can be enacted in many, many ways. So any more comments as we wrap up for lunchtime here? And so sorry that you are not able to join us for lunch here, Agenda, but I'm sure soon we'll be all in Mumbai celebrating and together on the next event that you are organizing in October.
Yeah, I look forward to everyone, and we have a major focus on data. I was finalizing the agenda, so we're going to focus on data. I look forward to being there in person to make up for my not being in Geneva, which was totally a medical condition, which I couldn't avoid, unfortunately. Personally.
Absolutely. And maybe also we can have some heads up on the session tomorrow with the Geneva Digital Health Day. You're going to make an intervention on Data First AI later at the Geneva Digital Health Day tomorrow, right?
Yeah, I think tomorrow. I think it's in the room next door. From memory, it begins at 3 o'clock, 4 o'clock.
Your intervention?
Yeah, yes. I think I'm on around 5, but I think. Yeah,
3 o'clock. 3 o'clock is the Data First AI later panel, right? with both of you. I think Steve will be on site.
Will be there. My colleague Ravi will be there.
Oh, Ravi will be there as well. Yeah. Okay. So that's a heads up for our viewers to stay tuned tomorrow. And of course, we have the community platform of GD Hub where you can all join and watch the session tomorrow. It's going to be a long day tomorrow with lots to go.
Yeah. Okay.
Any more comments, observations? That's before we close here the session, this hybrid session, so challenging but so amazing to have this collective intelligence gathered at the distance with technology.
Just that data first can also mean collecting data on data. So we need to get better, like measuring everything. If data is good, where it is going to, how policies impact. So data first is also that we need to collect data even after AI. So it's data first and data later. Yeah.
Collecting.
Sorry for wrapping up in such a striking way, but
it's amazing.
To my mind from your comments.
Collecting data on data, as that will ensure quality that we need. Absolutely. Okay, so without any further ado, we are going to close the session here as we are approaching the end of a very productive day. Thank you so much, dear friends from India, Professor Rajendra Gupta, Manpreet, and colleagues watching on Zoom. It's really great to have you here closer to our hearts, and hopefully we'll see each other in person soon. Thank you so much, dear participants, for this wonderful session here in the room. I was fortunate to have your contributions that are all being recorded, and we are going to have AI companion from Zoom to make a summary for us. I will try what's the difference between what we have harvested here and what AI will bring from us, and we all will make comparisons on the quality of the assessments of these summaries. Thank you so much, and have a rest of great day, everybody.
Thank you. Thank you. Enjoy your lunch.
Goodbye.
If your vision for healthcare is as boundless as your ambition, you're ready for the Europe-India Digital Health Week. This May, witness the groundbreaking Europe-India Digital Health Week, a unique fusion of minds and technology across 2 continents. We're not just talking about a conference. This is a week-long journey through workshops, interactive sessions, and knowledge cafes, each designed to forge ties that will shape the future of healthcare. From Berlin to Bangalore, healthcare professionals are gearing up to share insights, push boundaries, and ignite a global transformation in digital health. Whether you're a doctor in Denmark or a tech specialist in Tirupati, this is where your path to making worldwide health advances begins. Join us and be a part of this historical collaboration, because when Europe meets India, the possibilities are limitless.